Well, we can't do staging without doing grading. While staging is how bad is it, grading is the progression. Essentially, is this patient going to lose this tooth based on the rate of loss? So you're going to give your patient a grade A, B, or C. Reminder, only if they have periodontitis, an active infection from bacteria. Essentially what we're asking is, for this patient's age, am I concerned they're not going to be able to keep their teeth for their lifetime? You could do some math and divide the greatest amount of bone loss by their age, and you'd get a number. You can see it right along here. Depending on that number, you're going to give them a grade of A, B, or C. Could just ask yourself, my patient is 15. They have 20% bone loss. At this rate, am I concerned they might lose that tooth? Yes, I am. But if we take a 90-year-old and they have 20% bone loss, am I concerned about them losing this tooth? So sometimes that can help you get your grade a little bit quicker versus doing the math. If you have their record and you want to go back to the past and look at all their rate of loss, you could definitely do that and base the grade off of that. The case phenotype section essentially says, you know what, this patient has very little biofilm on the teeth, but they have an excessive amount or a rapid rate of bone loss. That would be C. Compared to a person where like, yeah, they have heavy biofilm deposits, this makes sense. That would be an A. Some of the grade modifiers are if your patient smokes 10 or less cigarettes per day, they're going to be a grade B. Anything 10 and over is a grade C. Currently, this is only for smoking, cigarillos, cigarettes, those types of things, not for vaping. We may see that someday. The other grade modifier that we know is a big risk factor for periodontitis is diabetes. So if they have diabetes, but their HbA1c is less than 7, they're a grade B. And if they're above 7, then they're at a grade C. And then essentially you're just going to choose the box that has the highest. So if we have 2 that fall in A, but at least one of them fall in C, then you're going to choose C. What other questions do you have about grading?